Greetings and welcome all. Thank you for joining our discussion today, Climate and Health, the Next Frontier of Climate Resilient Primary Healthcare. My name is Dr. Kimberly Green, and I'm past Global Director for Primary Healthcare. I'll be moderating today's webinar together with my brilliant colleague, Dr. Swati Mahajan, Health System Strengthening Lead for South Asia. She'll also be joining us as one of our panelists. Before we get started, I wanted to share a few housekeeping items. Next slide, please. So as you join the call, please introduce yourself in the chat box. It'd be wonderful to see who's joining us today. Also, note that we have translation in Portuguese for those that are joining us from Portuguese-speaking countries. And I'll ask the translator just to join us now and explain how to access that translation. I think maybe she's having a challenge to join us. So for those of you that would like Portuguese, just go ahead and click on the interpretation box on the globe sign at the bottom of your screen. So this meeting will be recorded and the recording and materials will be shared. Last, we very much welcome questions at any time, and we'll have an open Q&A towards the end of the webinar. But feel free to post your questions, and the panelists will also have a chance to respond in the chat. Over to you, Swati.
Thank you, Kim. We are joined today by three of our wonderful panelists. And so first up, we have Dr. Vincent Bretin. Vincent is the Director for Climate and Health at Unitaid. Then we have Dr. Agnes de Silva. Dr. Agnes is the Director for Department of Environmental Surveillance and Labor Health at the Ministry of Health, Brazil. And then we have Dr. Daouda. Dr. Daouda is the Head of Climate and Health Resilience at the Foundation S from the Sanofi Collective. So folks, we have a full agenda today. Like Dr. Kim mentioned, we will initially have engaging conversations and discussions with our speakers, wherein they'll brief us about all the wonderful work that they and their respective organizations are doing, what are their plans down the line, and what is the kind of impact that they're envisaging to see in few years down the line. And then in the end, we'll have question and answers with all the attendees. So stay tuned for a very engaging session. Over to you, Kim.
Thanks so much, Swati. So now we'll turn to a few slides to frame our conversation for today. Next slide, please. So climate change is the largest threat to human health in the 21st century, resulting in greater malnutrition, infectious and non-communicable diseases like dengue and COPD, as well as mental health problems, and increasing the likelihood of new health threats given the complexity of climate change and impacts on One Health, placing an ever-increasing burden on healthcare and in particular on primary healthcare. So in addition to this, extreme weather events caused by climate change, which many of us have experienced, including extreme heat, with recent dangerous levels of heat in India, current heat wave in the United States and in other parts of the world, altogether are associated with immediate loss of life, injuries, poor health outcomes, but are also associated with devastation of communities and livelihoods, and of course, disruption of primary healthcare services. We also know that low and middle income countries are the most impacted due to geographic location and still developing health systems and infrastructure. As a result, the World Health Organization estimates that climate change will cause 250,000 additional deaths per year between 2030 and 2050. And that the direct damage of climate change is estimated to cost between 2 to 4 billion per year by 2030. So in all, this threatens progress in universal health coverage and the goals that countries have set for UHC by 2030. We know that strong and resilient primary healthcare is an essential defense against health threats and is at the forefront of preventing, detecting, and responding and adapting to health impacts of climate change. But health systems are not just impacted by climate change. They are also the 5th largest global contributor to climate change because they release 5.2% of global carbon emissions. And that human-created greenhouse gas emissions are, of course, a major contributor to climate change as well as air pollution, which causes 4 million premature deaths per year. So in recognition of these profound and complex challenges, member states approved a landmark resolution on climate and health this year, at the World Health Assembly, which aims to accelerate action in mitigation and adaptation globally. Next slide, please. So now let's turn to what can be done in the future to mitigate and adapt to climate change impacts on health. The World Health Organization has put forward very important and clear concrete guidance on building health system resilience for UHC and health security, which was initially developed during the COVID-19 pandemic, but has cross-cutting advice and recommendations that are very applicable to climate change. So building on that, they put out the Health Systems Resilience Indicator framework with 64 key indicators, which again are very specific, very pragmatic, and link back to the climate and health resolution from the World Health Assembly, calling for things like vulnerability and risk mapping, early warning systems, use of alternative energies, and so forth. So these key indicators cut across all the health systems building blocks are integrated and very clear and useful. Next slide. Thank you. So as we move forward and consider what can be done in terms of immediate responses to climate change impact on health and the impact that healthcare has on climate change, it's clear that countries must adopt multi-sectoral measures to climate-proof health systems with an emphasis on safeguarding vulnerable groups. This was a recommendation that was brought forward by a policy brief, which was just published by PATH, including through our CEO, Nikolai Gilbert. This policy brief importantly calls for urgent actions that are needed to phase out fossil fuels and mobilize funds for climate vulnerable communities. Over to you, Swati, to talk about a very specific initiative which is focusing on how to move these recommendations forward.
Thanks, Kim. Next slide, please. The next one, please. Yeah, thank you. So we're going to be talking about one of the PATH's initiatives that we launched last year. So ARCH is the accelerator for resilience in climate and health. So basically at PATH, because we do a lot of work on innovations and we've been the global front runner on that, we're also trying to now see how innovations can be leveraged to address the impacts of climate change on health. Next slide, please. So last year at COP28 on the Health Day, we jointly with the Commonwealth PATH launched ARCH, which is our Climate Health Innovations Accelerator. So basically through ARCH, we're trying to build an end-to-end accelerator platform, which will not only help to scout, but also look at these innovations, deploy, generate evidence, document the impact of these innovations, and also help in technology transfer to companies, countries, provide support and help in scale up of these innovations to improve the climate health outcomes. So basically, the first of the things that we do is that we are building a pipeline of climate health innovation specifically around low carbon sustainable health systems, decarbonization of health facilities, energy efficient equipment, risk adaptation and mitigation solutions, early warning systems, community resilience solutions, and also capacity building solutions. We do not include proof of concept solutions in this pipeline. We have all the solutions which are technically at a readiness level of around, so technology readiness level of around 8 and 9, which are ready to deploy. And we've been kind of building this pipeline basically through passive scouting, talking to the innovators, networks that we have built in over the years, and also through active calls for innovations. So once these innovation pipeline is built, we're also looking at the vulnerability assessments and the climate risks and needs of the countries, so as to do a matchmaking and a transfer of these technologies to the relevant countries. At the same time, we're also building a funding facility for ARCH so that we can pool in funding from donors, as well as we can leverage and build in innovative financing mechanisms, design various instruments to be able to deploy these innovations at scale. And last but not the least, PATH also hopes to provide technical assistance to the countries to be able to, demonstrate these solutions at scale and take them to next level. Next slide, please. So because this was launched jointly with the Commonwealth, this gives us access to 56 plus countries of the Commonwealth. And many of us are aware that many of these are small island states, which are highly, highly climate vulnerable. So the reach of these solutions is going to be approximately to around 2.5 billion population. And we already have more than 100 innovations in the pipeline, of which 20 plus are high impact ones. And we are now trying to deploy some of these in our countries to generate impact evidence and also to generate evidence around their operational feasibility and their use. Next slide, please. So basically, like I've already mentioned, we go through a full cycle of looking at innovations, doing a needs assessment, sourcing of technologies, building a pipeline. Then after that, we do an operational validation to generate evidence on how these solutions will behave in the real-time health facilities and settings in terms of their relevance, their acceptability to the end users. And then also we optimize by providing feedback to the innovators to be able to refine their products and eventually help in technology transfers. And also we are building the narrative by kind of generating the impact and also documenting how these solutions will help. So this is all about ARCH. I think the next slide is only about that we partner with countries, innovators, and all the key stakeholders in the ecosystem to be able to do this. Over to you, Kim.
Thanks so much, Swati. So with that framing, now we'd like to turn to our esteemed panelists and start with the first round of questions, which focus on what are each of the panelists thinking about and doing now in terms of climate and health mitigation and adaptation. So let's start first with you, Dr. Agnes. While many countries are still in the planning stages for whole health system approaches related to climate change, Brazil is at the forefront of implementation of an integrated climate mitigation and adaptation plan. Tell us more about this implementation. How is it going? What are the challenges? But also, what are the promising impacts that you've seen that you think will be useful to others who are joining this call? Over to you. Thank you.
Good morning, good afternoon, or good day, everyone. It's a pleasure to be here with you. First of all, I think it's important to say that the health sector cannot deal with the climate crisis alone. We must say we pay the bill, we pay the price for the crisis, but most of the solutions are outside of the health sector. So it's impossible to work on the climate crisis as a public health problem without having the participation of other sectors. So what is happening in Brazil is that we have a national adaptation and a mitigation plan. Although they are working separately, this is at the highest level possible. So we have 23 ministries involved in the adaptation plan, and we're developing 15 sectoral plans, and health is one of them. And we have this conversation with the different sectors to include health as part of or the center of the adaptation plan. And the mitigation involves 18 ministries. The problem with this is that although the definition is largely for the whole country, there are many countries inside Brazil. So different levels of poverty and difficulties to work with. But in fact, the definition of things that would benefit all, including it would be central to Brazil, is this commitment to reducing deforestation that immediately has a huge impact on health, because if you reduce burning of the forests, it also decreases the impact on the local impacts of that action. And this is to achieve the zero illegal deforestation by the 2030. So defining mitigation and adaptation strategies that would enhance the capacities of various sectors, not only one sector, like the combination of them. This is what we want to achieve. But also expand initiatives that focus on this community adaptation, because everything happens in one place in a territory. So it needs to focus where should we start if we have a plan, where are the most vulnerable communities, and where live the people who will have the largest impact, and that we need to protect first, with the idea that if we protect the most vulnerable, we are doing the maximum that we can do to protect the whole society. And I would say in terms of what we want to achieve, climate justice, I would say a just and fair transition, energy transition, And for the health sector, this translates into ethnic racial equity in health. And this means we need to improve surveillance, so health surveillance, so we can see that. And we need to improve to make the system reach everywhere. We do have a very large system. I think the largest public health system in the world, because Brazil is huge and because we have more than 42,000 healthcare unities all over the country. But if you see the map, you see that we still have some large gaps, areas that are difficult to access. So we need expansion. And then how to do this, mitigating and at the same time expanding the health sector. This is a huge challenge, and that's the reason we think it's essential to work with innovation and technology. So we need the science behind to help us achieve what we are proposing. And we think on mitigation for the health sector as part of the adaptation, and not as only we do as the objective to reduce emissions. It is the objective to reduce emissions while providing full access, universal access, and to reach all areas and in the most vulnerable populations. So what we are doing is to think on practical means, how we do to provide and this using the power of this enrooted system, I would say, with all the more than 44,000 teams, like family health teams working everywhere, that also gets involved in this process of building our adaptation plan in the health sector. As Brazil produces as well vaccines and medicines, we are also proposing how to best serve, so the working on all the aspects of logistics and distribution, and how to improve this distribution without increasing the emissions. So also for the innovation and technology part that Brazil is involved to work on this sense. So this is basically what we are planning. It's a process. We don't see it ready. It's a 12 years plan, and we see it as building it up and changing as we learn in this process. So thank you.
Thank you very much. Really appreciate the fact that there's so much complexity, and particularly as you've described the multi-sectoral approach across multiple ministries, a whole of society strategy. And yet it's very important for us to hear about how Brazil is approaching this work, in part because you're centering vulnerability and really trying to build off of the SUS, your primary healthcare system, which is so robust, while also bringing in innovation. So I think there's so much to learn, even from what you are doing right now. So thank you for that. I'd like to turn now to Dr. Swati to speak about India, also a country with lots of variation and lots of different strategies that are underway right now to address climate change and health. Swati, there's a lot of really interesting innovation that's being proposed, like use of special paints to reduce heat in health facilities, using solar power for backpacks or carriers for vaccines in the community. Tell us what you're most excited about right now in terms of innovations in India. Over to you.
Thanks, Kim. I think you've already pointed out to some of these innovations. So like I was just mentioning about Arch. So through Arch, we're trying to build a lot of innovations, especially from a sustainability perspective in terms of decarbonization, and also in terms of promoting some energy efficient equipment. So basically, the solutions that you've alluded to, the paints that you're referring to, these are the passive cool roofing paints. So these passive cool roofing paints, they help to reduce the urban heat island effect, and thus they reduce the thermal discomfort. And so they help in reducing the vulnerability to heat related illnesses. So we are piloting this in a few health facilities in the Satara district of Maharashtra. These have also been piloted elsewhere in India, basically as a part of the cool roofing strategy. So this is a very, very low cost and sustainable cool roofing solution. It works on nanotechnology and NIR reflection technology, wherein the heat is reflected and thus there is a solar insulation. So it works on both cement substrates and metal substrates. And effectively, it can reduce the surface temperature by some 15 to 20 degrees Celsius and indoor temperatures by 5 to 8 degrees Celsius. So thus it helps to reduce, the need for conventional air conditioners, and hence helps to reduce the carbon footprint. And it's very low cost. Like I said, it just costs less than $50 for a square feet. And once you've painted a 5-layer or a 3-layer of coat, it can last for about 5 to 7 years. Similarly, other solution that you've spoken about, Embolio, which is a portable medical grade solar powered device. So it helps in last mile delivery of drugs, supplies, all other products like say vaccines or diagnostic samples and materials. So it comes in extremely handy from the last mile connectivity perspective, and also from the perspective of ensuring continuity of healthcare services during extreme weather events, disasters, or climate related risks. So it's a portable solar powered device which helps to maintain a temperature, a certain preset temperature, for around 12 hours. So that's enough for health workers to go and conduct outreach sessions. And so from a health equity perspective, this is very, very useful because it can store the medical products at a temperature of 2 to 8 degrees Celsius for around 12 hours, which enables us to conduct the service delivery successfully. So we are also piloting it in around 14 states. There are some 582 units that have already been deployed. Likewise, there are other solutions in the pipeline, such as low-cost, energy-efficient cooling solutions, which consume 80% less power than conventional, air conditioners. Low-cost indoor air purifiers, which can be retrofitted on ceiling fans, and within 2 hours of use, they can reduce the air quality index from 350 to 60, which is from severe to good. And also some point of disposal incinerators, which emit 95% less greenhouse gases than the other ones, or the traditional ones which are being used. So I see a lot of promise in these emerging solutions. Of course, we have to not only do an operational validation, but also figure out the technology transfer and cost effectiveness perspective, because if we have to scale them up and introduce them in public health settings, we have to look at these aspects. Thank you.
Thanks, Swati. And those are fantastic and really exciting. And then over to you for the next two panelists. Thank you.
Thank you, Kim. So now moving on to my role as a co-moderator, Daouda, I would first want to speak to you. Foundation S is another organization that has shown a very strong commitment to climate adaptation and mitigation in the past few years. And you're building very, very strong partnerships with local organizations, both in Africa and Asia. We also know that you have a call for proposals open currently. So we would want you to tell us and the attendees a little more about the call and overall the work that Foundation S is supporting. Over to you.
I think you're on mute, Daouda.
Thank you very much, Dr. Swati, and thank you, Kim, for inviting us to share Foundation S works. You're right. Foundation S has been focusing its work during the last 2 years in really trying to support locally led adaptations, right? Myself, I come from Sub-Saharan Africa. I'm from Senegal. I come from Africa, and where I come from, and the community I've been working in, the community I am from, we are confronted with direct impact of climate change. So, Dr. Agnes, you were saying that we need somehow to bring the response at the very community level. Communities where, as we can see, they are confronted with extreme heat. A few weeks ago, several people have been killed in Mali, in Burkina Faso, and in Chad because of the temperature was over 50 degrees Celsius. And we have seen also the strongest and the longest cholera outbreak in Malawi, in Zambia, in Uganda, and yet in the coastal area of Africa also, people are losing lands. They are losing access to clean water, and it comes to how do we support communities and vulnerable communities to respond to the impact of climate change. So our focus is essentially on how do we support local adaptation and how do we support responsive at community level that are really putting communities and people in the lead of the response to climate change. And this is extremely important because that's the best way to address the critical need that the community system for health, which is the primary system for health, is the front line, and we have to emphasize this because 80% of the health challenges are being addressed by the primary healthcare systems. So it's been also dealt at a very community level, and those same community are facing migration because in sub-Saharan Africa, for example, in the Sahel, sometimes migration is the only adaptation option that people are left with because of climate change. Second is that that same people around the Lake Chad that has been fighting over the last 3 decades against malaria are seeing the increase of malaria coming in. So these are real issues that communities are facing too, the real effect of climate change that we are trying also to support. What we are also conscious of the fact that amongst communities, there are groups that are more vulnerable and that have less access to health services. We are trying also to help the health system, especially the community health system, to build its own resilience, which is how do we restore health system in some of the country we are working with. The system and the health facility has been also destroyed with the effect of climate change. And you have to restore it. And restoring a health system in the context of climate change is also how do we deliver services so that it's accessible to the most vulnerable, the hardest to reach, and also how do we save the health forces also. They need to be prepared. They need to be the capacity to be built so that they can deliver the best in difficult conditions, but the best health services that address the health challenge that are related to climate change. And for us, really, national response to climate change start with community response to climate change. And that's where we are really focusing our response. And this year, we have launched a call for proposal that focused on really how do we support gender responsive, inclusive, locally led adaptation, as well as how do we recognize the leadership of women in really driving the resilience at community level to the effect of climate change. And by doing so, we are also considered to the fact that over the last years and over the context of COVID and different pandemic that Sub-Saharan Africa has been confronted with, the health system has been so weakened and burdened that it needs also to be rebuilt and it needs to be reinforced in a way that it's resilient, the services are accessible and are sensitive to the impact of climate change. So that is the focus of our call for proposal for this year. But since 2 years, we have been working in 23 countries where we are really supporting early warning system. We are supporting a program that are delivering climate sensitive services for health, program also that are addressing the very critical need for nutrition and access to water. And we are also trying to build the movement of civil society organization as well as a community organization that we absolutely need because they are the backbone of the community health. And they are the one where that can also support and enhance the national response to the impact of climate change on health. So basically, these are the focus of our work. And we are also trying to contribute to the global advocacy, as you know, Kim and Swati, and we have joined PATH and other stakeholders to really try to center health in the climate agenda, as well as advocating for better climate financing that are accessible and that are flexible, and that will respond ultimately to the need of communities that are facing climate change and their impact.
Thank you so much. I think it's very, very heartening to see how, you're investing in inclusive and locally led adaptation. And at the same time, you're also, pushing a lot of global advocacy. So I think you're truly in true spirit following think global and act local. So I'll now move on to Vincent. So Vincent, it was very, very intriguing to read the Unitaid report from milligrams to megatons last year. And I think we had a couple of conversations and exchanges at COP also around that. So we would like to know from you that how does Unitaid define climate smart health products, and which products or the categories of products are showing the maximum promise, and what is your plan and your thought process around that? Thank you.
Thank you very much, Dr. Swati, and a pleasure to be here today. Good morning, good afternoon to everyone. And so from Unitaid's standpoint, when we started to look at climate and health, we realized that because we're an organization that is focused on access to innovation in low and middle income countries, because we're focused on health product introduction, what made the most sense, looking at the landscape around us, the benchmarks, the analysis of how climate and health play together, was to start from the products, because this is our core business, this is our comparative advantage. And we came to realize that actually the products need to be looked at differently in the context of climate change and in different ways. And this is what we call climate smart health products. One, we need to look at products and make sure they are not harmful for climate and also for the environment. So in terms of carbon emission, but also the broader set of potential environmental impacts of health products. And I will come back to that. Secondly, the notion of resilience of products themselves, and it could be resilience to heat, to humidity, but also the resilience of supply chain. And again, I will come back to that in a second with an example. The third dimension is responsive, and we heard about how climate change is impacting countries, communities, disease. And so the products, the treatments, the diagnostics that we have today may not be the ones we need tomorrow to respond to the evolution of vector-borne disease, to respond to the evolution of the conditions of pregnant women in many settings around the world. And finally, thinking of products as being adapted and locally adapted. And again, we heard from Daouda in particular, the importance of local adaptation, communities, but also local manufacturing and the proximity to the communities that we are serving. So that's how we define more at a conceptual level climate smart products in the context of a climate and health strategy for Unitaid that was approved by our executive board in Brasilia last year and launched at COP. And in order to become more concrete in terms of the opportunities, we've conducted the study that Dr. Swati just mentioned. So we published a study a few months ago where we looked at 10 key products that are in our portfolio, but probably relevant to many of the participants here and anyone working in global health. Products like HIV treatment, malaria treatment, bed nets for malaria, diagnostics for TB, and so on. For each of those 10 products, we looked at the full supply chain and asked ourselves 3 questions. First, what is the carbon footprint of this full supply chain, globally speaking? Secondly, what are the environmental impacts or nature impacts of those same supply chains, so in terms of water pollution, air pollution, soil pollution, for instance? And finally, the reverse question, what are some of the climate risks on those supply chains? And do we think those supply chains are resilient to potential climate events in the future? And I'll give just 3 examples to illustrate some of those points. From a carbon footprint standpoint, we found that HIV treatment, for instance, and the first line treatment that is the most used in the world right now, has a very significant footprint, 2.7 million tons per year, despite the treatment being 650 milligrams of active ingredient taken every day by someone living with HIV. This is why we call the report milligrams to megatons. And for those of you who are not used to numbers of tons of CO2, 2.7 million tons of CO2, this is the same as the emissions of the city of Geneva, where I sit today, which is not a small city. So it gives a sense of how a single treatment can have a significant footprint. The good news, and we've shown that in the report, is that those emissions could be reduced by at least 40% without increasing the cost of production. I don't have time to go into the details, but it's mostly around the way API, active pharmaceutical ingredient, is manufactured and produced. Second example, bed nets. I think this is known to many people. Bed nets come with a significant plastic waste problem. We generate from the distribution of bed nets more than 100,000 tons of plastic waste every year. We don't have good ways to deal with this waste. Part of it is incinerated, putting carbon again in the atmosphere, but also particles in the atmosphere. Part of it is put in landfill and contributing to pollution of soils in the communities. And so that's another example of a footprint of a product. Finally, resilience. I mentioned the resilience of supply chain as being critical. Here, the example we like to cite is the example of malaria treatment, ACT-based treatments. And many of you might be familiar with the fact that part of the active ingredient comes from a plant that is cultivated in China. This is a plant that is sensitive to climate conditions. And we've seen in the past, in some years, when the climate is too dry, too hot, the yield of the plant can decrease, putting a threat on the supply security of the product. And then this is not over. The journey of the product continues in India, where most of the manufacturing sites are. But we know those sites are concentrated in a few regions of India that are themselves exposed to flooding. So one more risk, climate-related on the same supply chain. And finally, this is a product that has been shown to be heat sensitive. So if it's stored for too long at too high temperature, it could degrade. And we know that the countries where those products are being used are increasingly exposed to heat waves. And so that's a third risk, climate-related, on the same supply chain. So based on all of this, what are we doing in Unitaid? Essentially building a portfolio of investments, trying to address the biggest footprints or the biggest risk that we see in those products.
Thank you so much. And I think we are all looking forward to the portfolio that you're building, and also, looking at not only building that portfolio, but also looking at some business models that emerge out of it so that sustainability and viability can go hand in hand. Over to you, Kim.
Thanks so much, Swati, and thanks to our panelists for the first round of questions. We now want to turn to the second round. And here we're looking into the future, into the next 5 to 10 years. We're wanting all the panelists to look into their crystal ball and to make guesstimates around where they think we'll be and where they hope we'll be in terms of better mitigation and better adaptation. So Swati, I want to turn to you. There's a very interesting initiative that PATH has been involved in South Asia, bringing together those who are passionate about climate and health through SAC. And I wondered if you could tell us more about this alliance and what you're hoping to achieve within the next 5 to 10 years.
Thanks, Kim. So SUCH is basically Sustainable Action for Climate Health. So that's a collaborative that was launched last year in November, wherein the idea was to catalyze collective action in the climate health space by bringing together all the key ecosystem stakeholders, right from national, federal and local self-governments to development partners, donors, academia, think tanks, private sector, corporates, professional associations, and health facilities. So we have members across all these. So the vision of SUCH is to promote climate adaptive health facilities, workplaces, and communities by providing, by striking the right partnerships, and also by providing linkages to products, services, and finance. So we currently have on board close to 80 members. And like I said, we're identifying some system problems and some thematic areas wherein we will be advancing the work of the collaborative. However, 5 to 10 years down the line, I think we would definitely want to work at the first thing that we would want to look at is reduction in climate health related disparities, through targeted interventions, through this collaborative, and also through influencing policies. We would definitely want to make sure that we reduce the disproportionate burden of health impact of climate change on vulnerable sections, especially indigenous populations, those which reside in climate vulnerable regions, and also low-income communities. Second thing, of course, I think all of us would collectively agree we would want to invest in enhanced capacity of health systems so that they are better prepared and better equipped to address the climate-related challenges. Third for us would be integration of health metrics in global climate action policies, frameworks, and monitoring processes, because climate and health agendas can no longer be separate. They will have to go hand in hand. Fourth, of course, I think heightened public awareness and engagement. so that you drive home this point that climate crisis is a health crisis and it's going to affect everyone, and it's not that someone is going to be immune. From a collaborative perspective, I think 2 additional things that we would want to do over 5 years is to build an open source repository, which is kind of, helps in exchange of information, best practices, all kinds of micro evidence to catalyze collective action. And last but not the least, to scale up beyond South Asia. So, enable more South to South collaboration, more hyper-local climate health action, and also more advocacy and having a footprint at the global climate health landscape. Thank you.
That's brilliant. Thanks, Dr. Swati, and really hope that all of those come to fruition. I want to turn to you, Dr. Vincent. You spoke to the very interesting analytical work that Unitaid is doing related to a range of product categories. And you spoke to some potential ways in which to reduce greenhouse gas emissions, including with the manufacturing of ARVs, but also how to improve the resiliency of supply chains related to specific source products, like for malaria treatment. So would love to hear from you, where do you think we'll be in terms of climate resilient, greener product value chains overall in the next 5 to 10 years?
Thank you so much, Kim, for this really exciting opportunity to actually look ahead and try to be optimistic as well about where we could be in 5 or 10 years from now. So one thing I'd love to see is procurement done by countries and international organizations, including those criteria, and being guided by not only the health needs and the affordability question and the quality questions that are already there, but also environmental consideration when it comes to choosing manufacturers or products. I'd love to see regulators, whether they're global, regional, or national, to also start looking at health products with an environmental lens and start considering that as part of the assessment they make of products. Third, I'd love to see innovators, and again, wherever they sit in the world, that are working on health products or any innovation related to health. And we heard great examples from Arch, but to really take this mindset of, what does climate change mean for innovation? How can we use alternative materials when we design, products instead of plastic? How can we design, packaging? How can we design new generations of treatments with less active pharmaceutical ingredient? How can we think about product in that way, in target product profiles, in development? Fourth, regional manufacturing. There is a big push for many good reasons for more regionalization of manufacturing. In 5 years from now, I would love to see manufacturers in regions like Brazil or Latin America in general, in Africa, in Asia, that start to embrace those environmental considerations and not only manufacture locally the products that the communities need, but also do that without harming the environment and with focus on low carbon solutions. And we believe there is actually a potential to leapfrog for many of those manufacturers and already embrace those types of approaches. And finally, because in 5 years from now, we'll be almost in 2030, which is a key milestone in the Paris Agreement. We're all meant to reduce our emissions by 43%. And so I hope that we all on this call and beyond manage to reach this target for the organization or countries that we represent. Thanks.
Thank you so much. Those are very specific hopes, and I think that a lot of them are attainable, including related to procurement and factoring in climate change related specifications involving the regulators and making those decisions as well, but also in local manufacturing and more. So thank you so much for the vision ahead, Vincent, in terms of supply chain and products. Over to you, Swati, for the next 2 panelists.
Thank you, Kim. Daouda, we will move ahead with you. You spoke about the various investments and partnerships that Foundation has made in the past 2 years. So we would want to understand from you, what impact are you hoping to see from all those investments come through? And especially, in the hardest hit localities in Africa and elsewhere, what is it that you're looking at as impact, and what are your plans 5 years down the line?
Thank you, Dr. Swati. What I'm looking for is stronger and most resilient communities and most resilient community health system. Because this is the only way we can preserve the gain that we have had and we fought for many years. This is also the only way that we can strengthen the capacity of our own community to face the critical challenges that are posed by climate change. And I think all of the technologies, it's super important. All of the processes are important, but unless they support community capacity to respond to the impact they're dealing every day with climate change, then we still have a lot to do. And as I said, I have to recall it again. 80% of the health challenges have been dealt at the very community level of the health system. So our investment should be, how do we build a stronger system for health, which will mobilize community community-led organizations, and which will also empower the most vulnerable amongst the communities to be part of the response that will equip all of us to the impact of climate change. Second is that we hope that at our very modest level, we will show that investing in community works. Investing in those who knows what are the solutions, because they know exactly what are the needs they need to address. It works and it's effective. And third is that I think there is a growing awareness that more funding is needed, more investment is needed, but more investment is needed in adaptation. Those countries who are the most vulnerable are those who are underserved, where the investment has been not at the magnitude of the problems. And I think that we need more than ever today, more investment and more flexible and accessible investment for communities, especially communities who are most vulnerable. And I think we are not looking at, when we are talking about primary healthcare system, we know also that the primary healthcare system is constituted by community health workers. And we all know that the majority of community health workers are women health workers. And we all know that the community organizations also that are driving the response to climate change are led by women also. So we have to be very attentive to the specific and distinctive vulnerability of women and young girls when it comes to addressing also the impact of climate change. So I'm very much hoping that working with communities, working with the health system and building their resilience will generate more knowledge and evidence that will help us also to better tailor the global response to climate change and health in a way that it will reach the vast majority of the vulnerable people. And that's what our hope. And we will be continuing to advocate for more funding and more flexible and let's say friendly funding, because we have mechanism for funding, but most of them are extremely complex. Most of them are extremely complicated to reach. And frankly, we're at a time of emergency facing the climate crisis. So we have the intelligence to make the funding mechanism more accessible, more flexible, and more simplified, because as one of the ministers of health of one of the most vulnerable countries were telling us. So while I'm dealing, she was saying, and I quote, while I'm dealing with health emergency related to climate change, I'm being asked to fill different documents of this site to get consultants to help us to develop our plan. So that's where also we need also put the finger in terms of how do we make the system work for climate change at the community level to be funded, and for community organization to deliver the best response ever that we need to preserve and protect communities from the impact of climate change.
No, thank you so much. I think all of these were very, very, relevant and attainable targets, I think. So moving on to Dr. Agnes. Dr. Agnes, with Brazil looking at to being the host of G20 summit later this year and also COP30 next year, what do you hope are some of the agreements in progress that will emerge globally in terms of climate adaptation and mitigation in various countries as well, especially in Brazil for the next 5 to 10 years? While we are aspirational, but what do you think can be pragmatically achieved? You are on mute, Dr. Agnes.
I'm sorry. So we've heard many of the solutions that are either at a national level or local level, but these they are not disconnected to what happens at a global level, at what we need as to guarantee in the international multilateral agreements. So it's not of secondary matter what happens at the G20 and at COP30. Of course, we'll build on what other regions and countries have already achieved. So it's not inventing something new, but it's really making sure what we decided, and particularly what we decided in the Paris Agreement is really put into force. And then we translate this. So if we want climate justice, if we want health equity, and we want universal health care, we need to say how this has to be done considering the climate crisis. And so that's what we thought would be the best contribution we could bring to this discussion. So for the G20, we're bringing this, the idea that we need to work in this, with multi-sectoral approaches, and then with One Health approach to exactly work on the parts of the, there is one line on the health declaration last year for COP28 that we need to develop and into action. So what we're hoping is that this brings the priorities where they must be. And normally if we work with One Health approach, we'll be talking about things that will happen first in the most vulnerable places, and where the systems are exactly most subject of changes with the climate. But this is not the only important thing. One is considering financing, and I think everyone talks about this. So multilateral investment banks should prioritize and significantly increase the support for the health sector's adaptation to climate change. And I would say part of the adaptation is mitigation. And I've heard of the solutions with solar panels, and I always think of this point of care solutions. They need to be innovative. I say, I've mentioned in one of our meetings, a G20 meeting, if the Amazon is the largest water reservoir of the world, but the people there didn't have water last year during the biggest crisis, because if you cannot if the rivers are too dry, and this is the impact of climate change, but also because it's connected with the El Nino that makes it much warmer, and this, it will happen again and will happen more frequently, then you don't have transportation, so logistics over, no way to get into the areas of Amazon. And then this connection with if you cannot use the river for transportation, how do you get the diesel for the production of electricity? So medicines and vaccines over. So we need very important innovations to get there, to make sure what we already achieved is maintained, and that we do better, that we really keep this working in the big crisis, and that people lives will be saved for that. That's the reason we were thinking on 4 main axes, and this is health surveillance, and this means we need to work on data integration that will help us not looking into the what happened, but to foresee the future, and in a way that actions could be taken timely. So this is an important type of investment. Healthcare facilities, we cannot build the same places, all the health facilities that were under the water in the south of Brazil, and maybe you have seen the news. We cannot do it the same. So what are the adaptations we need to do? Do you need to be only in the first floor, all the equipment? We need to build better that in different places. We need all healthcare facilities to have this risk assessment prior to be built again. And this is valid for the whole system. Health promotion, and this is very well connected to what we want. It's not only that we don't want people to die in the emergencies, but we don't want people to die. Point. That's it. We need to do that and think how to adapt our discourse and bring all this to the whole system. And science, technology, innovation, and production. This is essential. Either we invest on that and with looking, and I really liked what Vincent presented. It's really practical. We cannot, it's not a theoretical thing. We need to think of what are the solutions here. This is the situation, room. So we need to go out when we have a solution for that. And this means when I talk about primary healthcare, of course, it's not only primary healthcare, but this is the basics. It's the roots. That's what the system is rooted when we have primary healthcare. So we need to get there. And that's the reason we think not only on that, but on this, what we call the transversal axis, is to work on these inputs like logistics, vaccines, equipment, the medicines, and this, how to make it cleaner, regional, independent, and easy access. And so I also liked this idea of organizing this. And I think without doing that, for sure, when the crisis got everywhere, nobody will think on distribution of medicines to everyone. We've seen that on COVID, and we don't want to repeat that. So no masks, no equipment, no vaccines, and this cannot happen again. So we need regionalization, we need transfer of technology, and we need to go more to go closer to where the needs are. So infrastructure is essential, finance is essential, and health workforce, without a health workforce prepared, there's no way we'll get there. So we need to make investments on that. And basically information, communication, technologies, and I would say knowledge management is what we need to invest. So data, well, I said integration is not a matter of sophistication, it's a matter of survival. So we need to do that. So these are the things we think, and I think it's all possible. And our plans will have to be adapted, but there is some sort of sensitization that was not there before. So I think we can build it, and we can build it better than we did before.
Thank you, Dr. Agnes. I think that's a very, very holistic approach, like adopting a whole of systems approach. And you've kind of touched on all the building blocks of health systems in terms of supplies, infrastructure, health workforce, innovations, finance. So wonderful. Thank you so much. Over to you, Kim.
Thank you so much. We're about at the end of our webinar. I want to thank all 4 of the panelists for the last round. Really, you spelled out key calls to action where you hope to see us be in terms of climate and health, but specifically what those calls to action are. So huge gratitude to the 4 of you. In summary, you called on multi-sectoral One Health approaches. It's not only the healthcare system's role and burden to address the climate impact on health and healthcare's impact on climate, that communities are essential. Nothing can happen in climate change without communities, and the essential role of them, communities in leading solutions to climate change, and the focus on the most vulnerable as being central to those conversations, including recognizing the role of women in both leading the response at the community level, but also the most impacted by climate change. And that financing is critical. We're not going to get to these key solutions that we've spoken to without the right financing, and that it needs to be simple so that communities and leaders of countries are able to utilize those resources quickly and efficiently, particularly in the face of so many climate crises, many of which are not predicted. We also need to ensure that there's innovation. Innovation, as Vincent spoke to, in products in the supply chain, innovation in our data and analysis, how we're looking at the problem and how we're coming up with very concrete solutions, and those that Swati spoke to related to affordable technologies we can use now to reduce the impact of climate change in health facilities, in healthcare delivery. And lastly, we can't do any of this without having strong and robust primary health care. Without that, it's very difficult to carry the burden of everything else that needs to be done to respond. So with that, thank you so much to our 4 panelists, Dr. Agnes, Dr. Vincent, Dr. Daouda, and Dr. Swati. We are wishing that your crystal ball is correct and that we see these changes in the next 5 to 10 years. Thank you so much for joining us.
Thank you.
Thank you very much.
Thank you.